It would be a great scandal if people understood how easily identifiable their medical data is and where it's going. Um, your medical data is quite valuable when it's bundled up with other people's data. It is essentially the key ingredient in many machine learning algorithms. Unfortunately, I often see that people don't really have the knowledge and training to understand whether data is anonymized or not. So I hope that in this episode, I can open your eyes to what good data anonymization is, why it's important, and what you can do about it.
So there's a lot to say, certainly more than I'm going to say in this one video about data, medical data, and secrecy. But if you haven't been in a coma, you've noticed we do have a problem. The answer to the problem is not to anonymize without thinking and not understand, because not every programmer knows how to anonymize data. In fact, a lot of supposedly anonymized data is data that someone, even at my level of programming, could unanonymize really quickly. But there's hope. You may feel like, well, who am I? I'm like a total baby programmer. I just picked up a computer last year. There's a lot you can do to protect patients or protect yourself. Even if you just listen to this full episode, I'm going to go over some really basic issues in anonymization, and hopefully it will help you and those you love stay safe.
So we can think of your medical data as being contained in one file for simplicity. And we could think of a file like a sheet of paper or this piece of cardboard I've got here. And it's got information on it. Okay? It's that simple. You've got a lot of information and some of it identifies you. In fact, using pieces of information such as your zip code or procedures you've had, insurance information, oftentimes we can reconstruct the rest of what's in the data. But let's keep it simple here. I'm going to write out an imaginary, very simple medical file that has your patient ID, your name, your address, and then, some info. So if I were designing a machine learning algorithm where what was important to me from patients was info, I would want to anonymize out the patient ID. Oh, it looks like it's coming in backward, but I would want to get rid of the other areas. So I might say, I will let the patient's files stay where they are, and I will write a program to extract the info. Okay? Just the info. But what happens when somebody writes in the info something that identifies the patient? Perhaps in the medical history, a medical student types in Mrs. such and Sophia Henderson. Sophia Henderson is a nice lady. Well, now you've got the name in the patient info, right? So you can't do a simple algorithm where you only take what you need. You also can't just delete the parts that you think are sensitive. In fact, oftentimes people find ways to purposefully encode patient identifying data in parts of a file you would never think of, just for whatever algorithmic reason. So you have to actually get someone writing a program, if you want files anonymized, who really understands that kind of file. So like, say you wanted to anonymize a bunch of DICOM files, well, you'd probably want to find someone who programmed with DICOMs before. Maybe someone who'd made a DICOM viewer, because they would be familiar with DICOM files. DICOM files in particular are total dumpster fire in terms of how hard it is to learn to work with them. But no matter how simple the electronic medical record, you can have information where you wouldn't expect it. So how do you make sure that the patient files are truly anonymous?
When it comes to making data really anonymized and protected, it's actually very complicated. And what I have to say would not be summed up well in a few slides, but I'm going to give you 10 tips. And the first one is if you're a healthcare provider or someone in the field, like, say, an administrator of healthcare, and you're doing some sort of project or research, work with a programmer. I hope it becomes really fashionable for all healthcare providers to learn how to program. It will certainly drive up traffic on my site. But just because you know the meaning of a variable does not mean you know how to anonymize data. In fact, not every programmer knows how to anonymize data, and that segues into tip number 9. If you're a programmer, work with another programmer. Even if you do know how to anonymize data, there are certain things like testing, adversarial testing, that really you can't do by yourself when it comes to making a program to anonymize data. My tip number 8 would be to watch out for stamps. So I'll give you a quick example. Let's say you want image data from people. That data would come in a lot of cases with timestamps on it. Do you want the timestamps? They give you another data point that someone can use to reconstruct the data in such a way that they de-anonymize it. So stamps are just actually one example of data that is somehow encrypted or added on to other data. So watch out for things like that. Tip number 7 would be that there's no substitute for expertise in the data itself. So if we're talking about electronic medical records, you would want to understand the process that was used to create that record. That might mean talking to secretaries, doctors, PAs, nurses, and other people who actually enter the data and understand what it means. My tip number 6 would be to only ever bother taking the data that you actually need. So if you are doing research on the time that patients come into the emergency room, you don't need their names. Don't get their names. It's just another problem for you where you can trip up yourself. My tip number 5 would be to think about machine learning and other reconstruction methods before you make your algorithm or do your research or create your program. My tip number 4 would be that there is no one-size-fits-all algorithm. I wish there were, and some people seem to think there is, and that they can just Google an answer about patient privacy or how to anonymize patient data, but it doesn't work that way in the real world. You can Google and find instructions that would not apply to your particular records. My tip number 3 would be to learn about encryption. I'll probably have a segment on that. My tip number 2 would be to take cybersecurity seriously generally. And my number 1 tip about anonymizing data is test, test, test. If you have made something you think anonymizes patient data, or you believe yourself to have anonymized patient data, test it. Test that program or test that data to see if it's truly anonymous. Usually the first time you do it, you'll be surprised at what you find. It is quite tricky to anonymize data. So, my fellow healthcare providers, I'm going to have to red pill you. I know that you believe that we live in a world with increasing technology that is doing increasing good for people. And the more technology we have, the more secure we will be, right? Well, I'm sorry. The more technology comes into hospitals, the less security patient data has. Things like the Internet of Things just open brand new avenues for hackers and other people who would love to compromise patient data. In this YouTube, I spoke specifically about anonymizing patient data, and that's one of the ways that we can protect patients. But let me flip this script. Have you ever thought about you? Have you ever thought about the security of your hospital? I specifically mentioned DICOMs. DICOMs are a great way for hackers to get into your hospital because they travel around from hospital to hospital. You know,
It's quite interesting to think about all of these cybersecurity issues, not just anonymization. And if you're interested in those topics, please leave me a comment and I'll do further episodes about it. To like, comment, and subscribe.